Morning, everyone. So we will cut right to the topic of the day with the news you probably already heard about putting a pause on administration of the Johnson & Johnson vaccine. The rationale for this coming from the Centers for Disease Control and Prevention and the Food and Drug Administration at the federal level relate to their safety monitoring system capturing 6 reports of Johnson & Johnson vaccine recipients having a rare clot in the veins of the brain called a cerebral venous sinus thrombosis as a connected in time with having been vaccinated with the J&J product. All 6 cases occurred in women in the age ranges of 18 to 48, and symptoms occurred 6 to 13 days after vaccination. So that's 1 in a million. And it's not yet been definitively established that these events are connected to the vaccination, but certainly the safety signal that it sends warrants further review. And indeed, further review is occurring. CDC will convene a meeting of its Advisory Committee on Immunization Practices. That's the body of experts, national experts who are not employed by CDC, but who are independent academic and other physicians, vaccinologists, other specialists to look at the data on this and render an opinion about the safety concerns that it may raise or not. Meanwhile, it seems prudent to just put a pause on things. So until that process is complete, hopefully later in the week, CDC and FDA have recommended this pause in the use of the vaccine. Again, I want to emphasize that this effect appears to be extremely rare. 6 cases with over almost 7 million doses of this vaccine given nationwide, and these 6 events, so that really being 1 in a million. Here in Snohomish County, we have received 24,000 doses of Johnson & Johnson vaccine. Virtually all of those, I don't have an exact count, but most or all of those have been administered. We have had no reports of safety signals locally with respect to this vaccine. People who have received the Johnson & Johnson vaccine, who develop a severe headache, abdominal pain, leg pain, or shortness of breath, those are all signals of various forms of blood clots forming in the vein. If that occurs within 3 weeks after vaccination, they should contact their healthcare provider. And if those symptoms are severe, they should go to the emergency room or call 911. Again, I want to emphasize the rarity of this event. COVID, notwithstanding that rarity, vaccine safety, whether it's for COVID or any other vaccine, is a top priority for all of us. And we all take reports of health problems following vaccination very seriously. And the federal government has set up a very robust system for detecting these concerns, both through reports of vaccinators and clinicians that witness any adverse effects occurring during or after the vaccine administration. And then as well, those of you who have been vaccinated, you know that you get encouraged to sign up for vSafe, which is a patient-oriented interface for CDC to monitor people's well-being after vaccination. So presumably these findings are a result of that strong system. I must add, as a public health official responsible for the, all of our well-being with respect to COVID and controlling the pandemic, we must also take seriously the potential impact that any false alarm can do by unnecessarily undermining our confidence in what appears to thus far be a safe and effective vaccine, or in the overall vaccination effort itself that is essential to our exit from this health, economic, and social crisis that has gripped the world for over a year now. Virtually no medical intervention is 100% free of risk, and many vaccines and countless other medical interventions occurring this very day have risk greater than 1 in a million and benefit to risk ratios which are much less favorable than COVID vaccination. So I urge patience and an open mind on the part of the community and restraint in how this is portrayed to them as we wait for the deliberations of the FDA, CDC, and likely, I suspect, the Western States COVID Vaccine Safety Review Board about the impact of this extremely rare event upon the future use of this effective vaccine. That's all the information I have to share at this moment on that matter. And of course, we will continue to monitor the situation closely, provide updates as necessary, and guide our own practice in vaccination based on those findings. Before I pass it on to Jason, I want to cover a couple of quick things. First, the roadmap to recovery. Yesterday, the governor's office announced its update on the opening plan, where we remain in phase 3 in Snohomish County. Most counties remained in phase 3 with a few exceptions. I just want to cover a few of the data items. Again, our case rate calculated by the state was about, I think, 155 or 160. Our case rate calculated and posted on the internet on our website is just a touch lower at 145. That's because the state counts antigen positive cases, which are a small proportion of the total cases. Historically, we have not counted those, and so our numbers are a little bit lower in the absolute level, but the trajectory is the same. And so although we remain in phase 2, that combined with the uptick in hospitalizations, the state calculated rate is 3.1 people per 100,000 in the last week of March, which is the week they counted, were hospitalized. That keeps us in phase 3 there as well. The border or the threshold is if there's more than 5 hospitalizations per 100,000 in a week. That's the entrance to phase 2, and the entrance to phase 3 or phase 1. Further restrictions beyond that would be if we had more than 10 per 100,000. I will say that when we do our hospital counts, we only count those people who are hospitalized due to COVID. Many people are hospitalized with COVID for another cause, motor vehicle accident, injury, heart attack, what have you. So we don't count those. If you exclude those, the hospitalization rate for the last week of March was more like 2 per 100,000 per week. Either way, it's gone up a bit, and we're seeing more cases, a few more hospitalizations. We haven't seen an increase in deaths or in long-term care facility cases, but these are all signals that we've got some rolling back to do. Even though we have the privilege of remaining in phase 3, I would suggest that just because it's allowed doesn't mean it's a good idea. And so again, try to keep those face coverings on all the time when you're not in your home, and avoid gatherings, and just try, when you do have gatherings, try to keep things outside. All the basic messages we've been saying before. Last week, there was an updated report, and there will be an updated report weekly on the variants. No surprise, the proportion of total cases accounted for by the variants, particularly the B117 or the UK variant, and the B1429, which was originally noted in California. Those are expanding rapidly and are taking up a larger and larger share of the total cases. They're more transmissible. That's just the reality of the situation. That's why they're displacing the other strains that are out there. And so we have less margin for error. All the more reason to double down on our efforts to prevent things and to be careful about what privileges we do take advantage of in terms of gatherings and the such. Vaccine. We have 30,000 doses of vaccine coming to Snohomish County this week. Roughly split between first and second doses, roughly split between Pfizer and Moderna, with just a touch of Johnson & Johnson that will be put on hold. But again, keep in mind that at that rate, it's going to take about 10 to 12 weeks for us to reach the 650,000 eligible adults in Washington or in Snohomish County. This is not something that's going to happen overnight, so we encourage both your patience and perseverance in looking for that spot to get vaccinated. So with that, I'll turn it over to our Director of Emergency Management and partner in the response to COVID-19, Jason Biermann. Jason.
Thanks, Dr. Spitters, and thanks for the partnership as well with the Health District. I have just a couple of things to cover this morning. I'm going to highlight some of the progress we're making, kind of what's coming next with increased demand, and then ask for everyone to focus on diligence going forward and reiterate what Dr. Spitters talked about. But before I jump into that, I did want to start with just giving folks an update on what is the impact of the pause of Johnson & Johnson usage on our mass vaccination efforts and the vaccine task force. So Angel of the Wind site will not be open today, and we're going to wait for further guidance from Dr. Spitters, the Department of Health and CDC as to when we will reopen that. That was the one site, one fixed site where we were using Johnson & Johnson. So folks are aware there were about 2,500 doses that were scheduled to go out through Angel of the Winds this week. What we're going to do is reschedule folks, as we know, certainly for the appointments today. There will be a message going out probably within the hour to all the folks that were scheduled for today, letting them know that they will either reschedule or we will reschedule them at another site where they'll either get Moderna or Pfizer. We'll continue to do that throughout the week, so folks will get notified, and we're going to do our best to accommodate them either at another site, or the other place we were using Johnson & Johnson vaccine is with our mobile teams. We do continue or plan to continue deploying our mobile teams this week as well. We will simply shift the type of vaccine that they're using from Johnson & Johnson to Moderna. So they will continue to go out into the community and do the same work that they've been doing over the last several weeks. So that sort of covers the impact, the immediate impact. I want to touch on the progress we've been making overall. We are making significant progress in our vaccination efforts. As of the end of last week, more than 150,000 people, Snohomish County residents, have been fully vaccinated. So that's 1 out of about every 4 who are over the age of 16. We now have 6 mass vaccination sites that are open and operating. They're not all operating on the same day, so all 6 may not be running on the same day, but there are 6 that are open and available. Because of the limited vaccine supply, which I'll touch on in a little bit more detail, they, like I said, can't all run every day, and their hours are still somewhat limited. For example, last week we didn't receive a Pfizer allocation. So the Arlington site was not open. It will be this week because we did receive Pfizer as part of the allocation Dr. Spitters mentioned. We are, as I mentioned, also going out through mobile teams. Teams have gone out to senior housing, adult family homes, folks who are experiencing homelessness, going out to congregate shelters, and reaching out to folks who are homebound. And again, we're going to continue to do that work. We're also working closely with developing community-based clinics with historically marginalized populations. Over the course of the last couple of weeks, our team from the Executive's Office of Social Justice, in conjunction with SHD, have reached out to community organizations in Snohomish County, developed a process by which they can let us know their interest in having a community-based clinic. Today we'll begin the first review of those folks, those organizations who have sent in their interest, and then we'll start scheduling those. All of that said, our task force has administered about 130,000 doses just over so far in the month of April. So just a couple of weeks in, we've administered about 130,000 doses between first and second doses. And that's part of nearly 400,000 total doses that have been administered countywide with all of our partners. I will say our progress is limited by supply. That continues to be our largest barrier. I mentioned that we didn't receive Pfizer last week. And even before the announcement that Dr. Spitters just shared, we anticipated, because of communication from the Department of Health, that we would not be receiving much, if any, Johnson & Johnson vaccine because of the nationwide bottleneck and their issues with their supply. With the cramp in supply, it does come at a bad time for lots of reasons, including on Thursday on the 15th. All Washingtonians age 16 and over will be eligible. 16 and over if it's Pfizer, 18 and older if it's Moderna. We do expect that there's going to be a great interest in appointments. I do want to highlight to folks that while everyone will be eligible if they meet those age requirements, the tiers that we had developed were intended to target the folks who are most at risk first. So we're going to ask that folks be patient, to recognize that by design, we're trying to reach the folks who are most at risk. We have already reached out to adult family homes, like I mentioned, other areas, but we do need to be patient going forward because there will be a lot more people who will be eligible. We don't have a supply that will allow us to meet everyone's needs immediately, but we're working very diligently with our existing sites and with our partners to try and get everyone vaccinated as quickly and safely as possible. Please don't get discouraged. I understand folks get frustrated because appointments arrive and flee very quickly. They get gobbled up very quickly. Please be patient. Please continue to be diligent about trying to get vaccinated. You can certainly reach out through the website or through our call center. I believe the number's been shared with folks. If it hasn't, we can share it at the end. But we do want folks to continue to reach out, both through us and through the other healthcare providers countywide who are providing vaccines. The last thing I will mention is just speaking of diligence, we all need to be diligent. We are lucky that we did not go back to phase 2. As Dr. Spitters mentioned, our case rates have been climbing. Our trajectory is going the wrong way. And I think the governor, although only 3 counties went back to phase 2, has sent a clear message that he's serious about enforcing the metrics. So we do need everyone to remain diligent. We do need to expect that if we cross the threshold that we would go back. So folks have heard this many, many times: wear a mask, maintain distance, don't congregate, especially indoors, and again, get vaccinated when it's your turn and when appointments are available. We have to do everything we can to keep the case rates down so that we can continue moving forward and continue our progress back toward the new normal. We know that there's a lot to lose. We've highlighted a lot of that, and I think folks are very aware that, you know, going back to phase 2 means greater restrictions, and certainly none of us want to go back to that. For the upcoming week, as I mentioned just in closing, our Arlington and Monroe sites will be available for first and second doses. We have other first dose appointments available at the Boeing Activity Center and other second doses available throughout the county. So I encourage folks to reach out again through the website or through the call center to get scheduled. And with that, I'll close and turn it back over to Dr. Spitters and to answer any questions.
Thank you very much, Jason. And again, DEM has been right at our side or out in front, leading us, breaking the, you know, making room for us all the way. And, you know, having given 130,000 doses, a third of the total doses administered in the county, and just remarkable contribution, and a big part of why 1 in 3 Snohomish County residents now has been vaccinated at least once, and 1 in 5 fully vaccinated. So outstanding. So I'm going to go down the chat here. Nick Popham, your question about J&J appointments, I think Jason addressed that. So I'll move past that one. Next question. When I say we have some rolling back to do, what do I mean? Am I in favor of more restrictions, which counties are allowed to do on their own? And do I believe the hospitalization rate is the best judge, or is hospital capacity better? Well, first, when I say rolling back, I'm just, as individuals and families and communities, look at the numbers and see where they're going if we don't change course. So, you know, we've been here before, and so we know how this happens. So, you know, at this point, you know, let's go with the metrics. We're in phase 3. Let's try to protect you know, the businesses, all the activity that supports our society that is permitted by phase 3. But to enable that to continue, we got to exercise restraint in our personal lives, reduce those gatherings, put a mask on when you go into public places. Don't, try to avoid bringing in people into your home that aren't from your family, especially if they aren't vaccinated. And, just common sense, just try to turn the interaction down. That's what I mean. Or we're going to go to a place where, then it'll be mandatory and it'll have an impact on all those economic and social and other factors that we have the privilege of enjoying now. So that's what I refer to, self-restraint. And then, there's no single metric that is the winner. I think we have to just look at the broad palette of the information that's out there. I think the current metrics do a reasonably good job of that. How many cases are occurring and what's the hospital situation is as good as any, and a lot brighter minds than mine have been thinking about this for a while. So let's stick with the framework and make it work for us. Next question, is Angel of the Winds the only county vaccination site using Johnson & Johnson? Yes, and most of the Johnson & Johnson that's come into the county has, I believe, gone out through that or some of the other county-based outreach efforts that Jason was mentioning. A total of 24,000 of the near 400,000 doses administered in the county. So just above 5% of total doses. How long do we think this pause will last? And if the issues are so rare, these venous thrombosis or clots in a large vein in the brain, 1 in a million, why pause such a massive effort to use this vaccine as opposed to monitoring for a few more days before shutting things down? So, very fair question. And we don't have total visibility on what it is that's motivating CDC and the FDA. And it may just be, as we suspect, it's just an abundance of caution. And as I said earlier, that's not without risk either, because it can impact individuals or the community's confidence in this product or in the whole effort. So, I am anxious to see it resolved quickly, and hopefully I believe ACIP is meeting tomorrow, and hopefully we wrap this up in a few days and get back to work with the Johnson & Johnson and other vaccines. I don't have direct view of what they're concerned about other than what I've just shared with you. But on that basis, as I've said, we engage every day today. Many far more unfavorable risk-benefit events will occur in healthcare than a 1 in a million chance. So I look forward to seeing this resolved, and then we will respect that outcome and adjust our operations as needed based on what comes out of that. When Snohomish County hit 45 doses a week, I'm going to guess you mean 45,000 doses allocated a week or two ago. How much of that was J&J? We haven't gotten a lot in. We can get back to you with sort of like what our allocation is. The total to date, as I said, just over 5%, 24,000 doses. Yes, our overall allocation has dropped. It's fallen a little bit short of what, the lengthier qualitative forecasts had been when we were back in March. The statewide, we're still sitting at, roughly 400,000 doses a week coming into the state, which is our state's per capita share of what's available at the federal level. And then we in Snohomish County, it varies a little bit week to week, but over the long haul, we're getting about 10 or 11% of the statewide supply, which is our population's proportion of the total state. So although it's slower and it's limiting our ability to utilize that tremendous capacity that Jason and the county have built up for mass vaccination, it is what it is, and everyone is in the same boat. Other counties, other states, it's just not as much as we hoped for, but we're going to take everything we can get. Um, How do we combat vaccine hesitancy in the wake of the pause, considering vaccine hesitancy is already a problem? Well, again, fair question, and I think my earlier comments speak to the, there's no risk-free pathway in a moment like this. You choose not to stop. Some people are going to be concerned that you chose not to stop while waiting for the answers. You choose to stop. Some people are going to get unnerved by that and wonder what's going on. So, either way, it's a difficult choice, but I think we just information, facts, and try to combat disinformation, misinformation with facts. And so, just urge all of the people of Snohomish County and beyond to consult reputable sources for all of their medical information, including COVID-19 vaccination. And then hope for the best. Our job is not to convince, it's to educate and support people in making good decisions for themselves. And at some point, we've got to let go, and after doing the best we can. Oops. Has the health district been told why the weekly allocations aren't meeting the expectations laid out? As Jason mentioned, and I said, it's just the national allocation. We are getting our per capita share. It's just the mega supply at the federal level is a little bit less than forecast. The county's new case rate has gone up again several weeks running. We still have some cushion, but do we expect to continue to a point where there's a real risk of a fall back to phase 2? Yes, absolutely. I think, the health officers of all the counties, we meet once a week. We're all tremendously concerned about where this is going. This is not just here that this is happening or just me that's concerned. We all think that uninterrupted, we know where that line's going, right back where we were with the third wave. So it's on us to be even more vigilant and more attentive to these prevention measures, because the current strains that are going around, they're just more slippery. And I think there's a little bit, it's not all the variants. I do think, we're hearing through our contact investigations about, unwise gatherings and, too large or no masks or indoors. And we all know better than that. So we're almost there. And, in human nature, often we kind of rush to the finish right when we were, approaching success. So I urge everyone, be patient, stick with the regime, stick with the framework for prevention, and we will arrive, but we're not there yet. If we try to cut to the finish now, we're going to have problems, and you see it in those numbers. Let's see. Well, I'm going to turn it back over to Kristen. Kristen, I'm sorry, I just saw your text. So please, I'll hand it back to you now rather than when I should have earlier.
That's quite all right. Actually, I'm going to turn it over to Jason for just 1 second here. He has something else to add.
Yeah, just real quickly, I saw a couple of the questions just to reiterate, because I think this will be of interest for the folks. If they had an appointment scheduled, Angel of the Winds, we will reach out to them to try to either reschedule them either later in the week at a different site, or we're looking at transportation options for folks who maybe don't have the ability to transport themselves to another site. So again, if everyone can help us with that messaging, we will be reaching out to them and trying to make arrangements. I saw a number of questions about what folks should do if they already had an appointment for J&J. At least at our sites, we've got a couple of things we want to make sure we have in place so we have good answers and good availability for them, but we will get that out. Like I said, hopefully within the next hour or two, but certainly by the end of the day.
Yeah. Thank you, Jason. I kind of got on a run there. It shows I'm not a great moderator, but thanks for stepping in. Any other comments you had about the other items at all? Okay. And one thing, I don't know that there are a lot of healthcare providers listening, but if you are a healthcare provider in Snohomish County and you're listening or hearing this, just hang on to your J&J vaccine. Don't send it back. let's wait and see how things pan out over the next few days. We would encourage you to defer using the vaccine until things do run their course over the next several days, but don't worry about calling us or sending things back. Let's just hit the pause button and catch up after we learn about where things are going.
All right, this is Kristen in the Joint Information Center. Thank you again for joining us today and for your questions. We are going to go ahead and wrap up. Please stay tuned for future media availabilities.